wanted to bring a few updates. First of all, with respect to personal protective equipment, we're continuing to work hard in what is a tough supply market to obtain PPE. Since my last update on Friday, we've received a small supply from the federal government. We've also received a significant number of surgical masks and N95 respirators that are undergoing assessment and testing right now. As the masks are not from our traditional suppliers, we need to make sure they are safe and effective before putting them into circulation with healthcare workers. With respect to ventilators, I wanted to say that at our March 27th briefing on epi modeling and the healthcare capacity, I told you that we had 457 adult critical care ventilators in our inventory, of which 348 were already available at our large COVID sites. I'm happy to say that just over a week later, with all the additions we've had, we now have 620 adult capable critical care ventilators already distributed throughout our large hospital. We also have 33 of our newly purchased critical ventilators ready to go, plus 55 new ventilators that just arrived this morning from the National Emergency Supply that we're in the process of reviewing and testing for usability. As Dr. Henry has said, it's absolutely important right now, critical, that everyone comply 100% with her orders and with the orders of the federal government under the Quarantine Act. In particular, that means people returning to British Columbia, returning to Canada from abroad. We understand that many Canadians are going to be diligent and careful to observe the rules, but there will be cases where lack of information or lack of resources or both make it difficult to self-isolate. So we're continuing to work with the Government of Canada to improve protections for all Canadians. It makes sense for every single person to have a plan in place with no exceptions.
And so we're at, in that document, we're at phase 4. That's what we're using in terms of how we are prioritizing, cohorting, and using of PPE in the healthcare system. We don't have any supplies that I'm aware of that have been affected yet by the concerns from the U.S. We are sourcing supplies from many different places around the world, including in partnership with the federal government.
Well, we certainly feel good as to supply, but we've put in place, as Dr. Henry has said, measures to ensure that we're using PPE properly so that we extend current supply. As I've mentioned, we've received some supply from the federal government. We've had much discussion with them about the distribution of that supply, and they're very confident in their efforts to deliver more, and we're very appreciative of those efforts and our joint efforts together in that. In addition, we've had some success ourselves. So I can't give you the precise numbers of how many we've received from different sources. We're not talking as much about the sources of supply and the sources of contribution right now, although there will certainly be a full accounting for all that at a later date. But what we are saying is that we need to continue to have the measures we're taking, and we had some success, both, as you can see from the report today, on ventilators, and some success this past weekend with respect to PPE. But we have to keep working on that, and we're hopeful that if we can get through these next couple of weeks, which are important weeks, that supply, the world supply, will become better for us. And certainly we have optimistic signs from Ottawa that there's supply coming from there as well. So our efforts have had some success recently, as of Ottawa's, and we're hoping for more.